Malaria is the greatest killer of humankind ever. It has killed more people than any other disease, and there are many scientists who believe that it may have killed up to half of the people who have ever lived. And even if people don't die from the disease, it has the ability to keep people in the cycle of poverty and devastate entire communities. When someone is sick with malaria, they can't work. Children cannot go to school. It reinforces additional problems.
My name is Bill Felt. I've been a Rotarian for 33 years, active in international projects for the last 16 years. I am a member of the Rotary Club of Federal Way, and we are the official sponsor of the programs of scale that we call Partners for a Malaria Free Zambia.
So we are very, very excited about the relationship with Malaria Partners International. We think it is an absolutely fantastic opportunity to leverage the energy and the commitment that the Rotarians bring to their engagements and to their efforts. We have been incredibly impressed with the work that has gone into polio eradication, and we just look forward to working together to ensure that these community health workers get up to speed, that they're trained, and that more people are able to access quality care than before, and we'll see the downward trends that we want to see across Zambia.
Partnerships are really critical to any achievements that we desire in a program like malaria. If you look at the kind of destruction that the malaria has had on communities, investing in such a program with an aim of reducing that level of suffering and hopefully at some point even going towards eliminating the whole disease, that is something that should get anyone excited. I had to attend to a lot of cases that came in as complicated malaria. Children are more prone to having malaria, and when they get malaria, the chances that a child will actually develop the severe forms of malaria are much higher than that of an adult. And also the progression of the disease tends to be much, much faster than the way it would be in an adult. It's never easy to communicate that bad news to a parent that has lost a child. What can be more devastating than that? The problem is big, and so definitely it does require concerted effort by different stakeholders and partners coming together.
A lot of the work that we focus on is improving data systems to help drive different decisions, not only at the national level, but also within given communities. And the intention is to build upon the existing system and the existing network of community health workers who are offering care within their individual communities.
Each one of those community health workers will be responsible for testing and treating about 500 of their neighbors in their community. If you do the math on that, the effort that we're putting into this is going to impact about 1.3 million Zambians.
If we get this thing right in Zambia, if we can start with this, expand a little bit and eradicate Zambia, then we look at Africa, then why not you take on the rest of the world? Because it can be done.
When we put our minds to something, we mean business, and Rotary, leading the Partners for a Free Malaria Zambia campaign, is a step towards the elimination of malaria in Zambia and globally.
With the right kind of intervention and the right attention paid to this disease, how wonderful it would be to be part of an effort to eliminate a disease that has killed more people than any other disease in the history of the world.